Well, this is Craig, and Craig has tarsal tunnel syndrome, which is a pinched nerve behind the ankle. And Craig, what's been your experience with this foot pain? How many years has this been going on?
I've had this foot pain for basically 4 years. I mean, it just went on so long, and I've been trying to get it diagnosed for that entire time, just off and on, going to different physicians. And I have other medical conditions, and I think they kind of were looking toward those possible problems and not honing in on what the problem really was.
Okay, so one hypothesis was that you had diabetes, but you don't have diabetes.
Right, that came up at least a couple of times. And then also it was believed that I had neuropathy, and I had a test done on that also came up negative. So I had a couple of doctors that were kind of scratching their head and weren't quite sure what was going on. But in my mind, I always thought to myself, you know, there's something somebody's missing, and I'm just not able to figure out what it is.
So you don't have neuropathy, you don't have diabetes, but your feet were hurting badly. What kind of symptoms were occurring in your feet?
Well, it kind of progressed over time, but it's hard to describe. It's like a numbness, but at the same time, like a tingling, like where your foot's falling asleep and you have this sharp tingling in your feet. And quite often it was just painful to even like wear socks. And so like in the evenings I would come home and the first thing I would do is just take my socks off. And then if anybody bumped into my feet, it was just like a painful sensation. So it was just kind of an odd thing, things that were going on. And so it was difficult for me to kind of describe it at the same time. But like I say, I've been battling this for 4 years, so I'm just glad it's been worked out.
Did you feel hopeless going to all these doctors and then
I had actually, I told my wife that I'd practically given up all hope, because I'd been searching on the internet, just kind of going on, you know, looking for what it might be. And finally one day I told my wife, I said, I'm just going to try one more thing. And so I just typed in what my symptoms were, and just on Google, and it popped up tarsal tunnel, which I had no idea what it was. And then I read what it was, and I just was in shock because these people were telling my story. And so then I just went on a search to try to find somebody that could, you know, possibly look at it and see if that's what was wrong with me.
So Craig has tarsal tunnel syndrome, and just about a month ago, 5 weeks ago, we did a tarsal tunnel decompression procedure, and you can see the incision there, and that redness and a little bit of swelling will subside with time. So it's only been 4 or 5 weeks. We did your left foot first. How's your left foot feeling?
Amazing. The very first thing that happened after the surgery, I told my wife, as soon as I came to where I could speak, I said, something's really odd. I said, my left foot is warm. And that's one of the things, I've had like a loss of warmth in my foot for 4 years. It's always cold. And I told my wife, I said, something's really weird. My left foot is warm. And there was like a bandage and a sock over it. And I was feeling the warmth of just having those on, which I hadn't felt in such a long time. And it wasn't soon after that the tingling sensation was gone in my feet. And I started to actually feel my toes again, which was it was quite an amazing thing, because I'd actually noticed that I was starting to lose my balance, and I had attributed it to the lack of sensation in my toes. Whereas if I stepped on an uneven surface, I was kind of uneasy. But then not very long, maybe just a couple weeks after the surgery, I started to feel my toes actually making contact with the pavement when I walked, and I had more balance in my feet. And so there was immediately, I had several things going on. My foot warmed up to a normal feeling that I had before. The pain and the tingling went away, and I couldn't be more happier with the outcome.
Right. This right foot's not very happy though, is it?
No. I basically have the same problem with my right foot. It's just it was a little bit less severity than the one on my left foot. So
we're going to take care of your right foot in a few weeks and getting you back to doing what you like to do without pain.
Yeah, because I'm a little in need of some exercise, and I wasn't able to do anything. Couldn't really walk very far without a lot of pain in my feet and so forth. So I'm looking forward to getting back and doing a little exercise and what I normally want to do.
Okay, thanks for sharing your story.
Thank you.